I'm Andreas Kamal. I'm an orthopedic surgeon. I practice in Manhattan in New York. Been here since 2018, and before that I was in Boston at Harvard for 20 years, and I grew up in Munich, Germany. I do see a lot of patients who, and I get that, who see multiple opinions. So oftentimes I'm number 2, 3, 4. Orthopedic surgeons have different experience levels, they have different skills, and they work in different environments. I've been for years, I would say, pretty good at being narrow but deep. I don't do elbow, I don't do hip, I don't do foot and ankle. 95% of my practice, I would say, is knee. I do a little bit of shoulder because I've always done shoulder, and in the shoulder I do biceps and rotator cuff. When I say narrow but deep, I don't do cases that I only do once or twice a year. I don't like that. I want to be good at what I do. I want to leave the operating room and feel good in terms of I did right by the patient. So why should you look here? If you have something like an ACL, anything meniscus related, whether you just need a little meniscus trim or you need a meniscus transplant, I do that more than most anyone. If you need a cartilage transplant, we looked at our numbers, cartilage transplants, donor transplants, there isn't really anyone who does as many of these than me or my wife. Like anything else, you do more, you have more experience, and you get good at it. You want to somehow be able to relate to your patient. So as a sports physician, we all treat high-level athletes. I can never put myself in their position because I've never gone there, but I've been active all my life and I've played a number of different sports and still do. I think if you don't know how much it means to patients' life, physical but also mental wellness, of being able to work out and do what they love. You listen to them, you examine them, you get all the studies you need. Because complex surgeries, you want to get them right the first time, and for that you need to have the right tools, the right implants, and sometimes that requires just a little bit more investigation. My viewpoint is really more long-term. When I see a 20-year-old, they really care to going back to sports, even if it's a month early. I see that, I hear them, but I also care if they can play with their kids when they're 40. So it's not that I don't care about going back 6 months versus a year, but I'd rather hold them back a little bit to make sure that they don't re-injure themselves, that they have the best possible outcome, so that whatever we do lasts them a long time. It's a little bit sort of the difference between a quote-unquote normal car mechanic and a race car mechanic. The race car mechanic cares about whether that race car makes it around the track 5 times. The regular mechanic cares how that car is doing for the next 50,000 miles.